Yeah, as you know, I mean, when you receive your Medicare card, you will see that there's a part A, and there's the Medicare number, there's the part A and part B eligibility. For some, they only get the part A, and for others, they only get the part B. And but it is nice to know that different parts of Medicare. So it's better that I explain it to you a little bit. We could browse through it, and of course, understanding where you are and how it works, Medicare. So it's better, correct? So the first one, okay, let's begin. So are you ready? So Medicare Part A is about inpatient hospitalization, wherein when you get hospitalized, you're using your Medicare Part A. And how did you get it? Because you worked for 10 years or 40 quarters and you contributed to your Medicare taxes. So when you get hospitalized and you go to a skilled nursing facility like a rehab, still it's covered by Medicare because it's a skilled nursing facility. Take note, it's not long-term care because long-term care is not covered by Medicare. So nursing home, in-care, skilled nursing facility. So I mean, I already mentioned that it's not long-term care. So home health care and it's the same. Home health probably is another thing, but home health care is the nurse that visits you after you got hospitalized. Maybe they're there to check your blood pressure if it's steady. Like if you had the surgery, they will check to find out, are you taking your pills? I mean, they do check your vitals and everything. They need to know because they're going to report your condition to your doctor. They want to make sure that everything is well, and that's brought to you by your Medicare Part A. For Part B, it's only, since we're talking about Medicare here, we're not talking about coverage from Part C. Don't get confused because this is how we start. We have to know Medicare first, the original Medicare, before we go to other subjects or other learning. So we have to do baby steps. That's what we call it, baby steps. So it's only medically necessary services. Like if you have fever, you only go there, but it's not for routine check or your routine blood work, because Medicare is not HMO. Okay, so the second one is preventive services. Partly they will cover because the thing is, if you go and you tell your doctor who takes Medicare, okay, you can go to a blood work, but of course you have to pay your 20%, you have to pay your copay, and you have to pay deductible. So the third one, mental health, inpatient, outpatient, and partial hospitalization. That's these things I'm mentioning. You have to have a Part B. If you don't have a Part B, at least you have another insurance from your group insurance that would cover this. Otherwise, you have to pay for these services on your own, because Medicare we're talking about Medicare Part B here. So durable medical equipment, just like Alicel was here, you can order from them. Platinum Medical Long-Term Care, LTC, wherein Medicare covers durable medical equipment. However, you have to pay a certain percentage, okay? And give me a call and I can give you their phone number. So ways to find out if Medicare covers what you need. There's a website that I mentioned here, and then it's medicare.gov/coverage. Welcome to Medicare Preventive Visit. You will see there everything is covered, but everything you have to pay. Your necessary copay, and the necessary deductible, a lot of stuff wherein it's not my expertise. And anyways, then don't forget, ask your doctor if you need certain services or supplies. If he says it's not covered, you have to pay for them. So this one, we'll going to Part C a little bit, Medicare Part C, but this is not everything, okay? This is just go through introducing you the parts of Medicare. So this is just a glimpse of what Medicare parts are all about. So benefits part, this is the benefits part of Medicare. It's called benefits part, or it's called Medicare Advantage. That's just one thing, because I have clients who call me and said, oh, I'm not enrolled in the benefits part, the Part C. Part C, benefits part, and Medicare Advantage, those are the three names, which one is the same. All of these three are the same. Okay? So when you have a Medicare Advantage card, that includes your Medicare Part A, Part B, and Part D. For some, it's optional, they say, because some have group health insurance, some are into veteran benefit. They do have coverage from the group plan, or from VA, or from TRICARE. So I put there optional. So, and then this managed care, this Part C is managed by health insurance carrier appointed by, no, it's CMS supposed to be, I'm sorry, I had the typo error. It's supposed to be CMS. CMS, not CMC, okay? So what is a Part D? A lot of people miss this, and for that reason, they get penalized. Well, it's so hard. And then some people, since they know it's optional, they prefer not to get it because it has a monthly premium when you are in the original Medicare. But Part C covers the prescription drugs. The thing is, if you don't get it, you will get penalized 1% every year. So if you miss some of my clients, they miss 5 years, 7 years, some even 9 years. But here's the thing, you get penalized for the entire year, and they go backwards. Like, for example, 1% of this month, 1%, and it varies because every year the fee, the premium changes. Okay, so I put there the number 4. Oh, did I mention number 3? It's included in most plans with Part C. So Part D is included in Part C, just to reiterate. And then number 4, if you have Part A or Part D, you must have a Part D. So must have Part A, or if you have a Part A, you can have a Part D. And if you have a Part B, you can also have a Part D, so that Medicare want to make sure your drugs are covered, because right now it's very pricey, it's very expensive for most medicines. That's why they want to make sure you have to have your Part D. You pay, but it's worth it because you save a lot of money. So thank you. Have a great day. And if you have a question, feel free to call. Any question about Medicare, Medicaid, I'm here to talk about, to answer all your questions. And I'm available 24/7 for you. I always have my headset on so that I can answer all the questions of my clients. On the last leg of our show, of course, we have to end. And I know you're excited, and thank you very much for being with me. So, by the way, we have to do a little bit of wiggle jiggle here and there. So here's another video And of course, I tried to research this for you, so you could just wiggle jiggle a little bit. Here, check it out.
I'm going to show you how to get your buttocks nice and round, toned, and strong to support your body and keep you healthy. Glute bridges, lay on your back, plant your feet into the ground, and lift your pelvic up to the ceiling. When you get to the end, hold it 5 seconds, squeeze the buttocks, come back down. Lift up again, squeeze the buttocks as hard as you can, pushing the feet into the ground, and come back down. To really shape up your buttocks, the single leg bridge is definitely challenging. Lay on your back, you'll go ahead and put one leg out, and then you'll lift up with the other one like this. And hold it 3 or 4 seconds, come back down. Lift up, come back down. Then you'll switch legs, come up, squeeze the buttocks, come down, and go up again. And these donkey kicks will work the entire glutes, as well as the hip region as well. Go on all fours. Bring your knee 90 degrees, foot facing the sky. Lift it up, push it up, squeeze in those glutes right in here. Hold it up 3 seconds, go back down. Push up again and squeeze those glutes. Make sure you do both sides.
Oh, what can you say? Did you have fun? Did you enjoy the video? Thank you for being a part of my show. I would like to thank you as well as Edelweiss Solano for her coming to explain how AC/DC can help public become a U.S. citizen. I also want to thank Liselle for stopping by and explaining about those bubble wrap that is very important to seniors, I know. And you can watch my show on my channel, Maria Care Senior Info Guide on YouTube, Facebook, Vimeo, and Instagram. I'll see you next week. Take care of your health. That's the only one you got. Let us join hands to a better health. Thank you, and I look forward to be a part of your Medicare journey.